As I've shared with you several times, breast cancer screening, mammographic screening, is the single factor that's lowered the death rate from breast cancer in the United States, had a huge impact in Western Europe and other areas that are doing breast cancer screening on a regular basis. One of the questions that comes up to me is, I have a positive family history for breast cancer. How does that impact my screening? One general rule is that with your first degree relatives, your mother, aunts, that we generally talk about 10 years younger than the age of diagnosis in that first degree relative. But you know what? There are many other things that go into really answering this question. How big is your family history for breast cancer? We have various mechanisms and formulas that we can use to estimate your risk of breast cancer. So it's a really open-ended question about, depending on my family history, when should I be screened, et cetera, et cetera. So here's what my suggestion is for a question like this. Contact a competent breast surgeon or breast center that can assist you in evaluating your family history. It may be that your own primary care physician is very good at this, or your primary care physician will send you on to somebody that your physician feels confidence in to help estimate your risk and to give you a credible, specific answer for your set of circumstances. That's my recommendation. I don't want to be too more specific because, again, the variances here and the vagaries of family histories are so large. Now, if you combine in your family history a history of ovarian cancer, as I've suggested previously on Breast Cancer Answers, then you need to be seen by a genetic counselor. So get yourself in the hands of competent folks that you can work with, figure out what your specific risk factors are, and then act accordingly. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.